Welcome to a new episode of Meet the Masters. My special guest for today's show is a man who established a chain of healthcare facilities with more than 200 unit hospitals, clinics, pharmacies, and diagnostic centers in UAE, Qatar, Oman, Saudi Arabia, and India. Let me welcome the Chairman and Managing Director of Aster Healthcare, Dr. Azad Moopen. Welcome, Dr. Moopen.
Thank you. Thank you for having me as a guest today.
Dr. Azad, as a start, could you tell us, please, a little bit about yourself and about your journey in building Aster Healthcare?
Sure. See, this journey started about 27 years ago. I came here just as a doctor to practice, and I was planning to be here only for a couple of years and going back. But it turned out to be a destination. I always believe that God has something in store for you, and you decide something, but He decides what actually is going to happen. I wanted to go back, but circumstances pushed me in such a way that I started liking this place. I thought there is a requirement, and then stayed back, and now it is 27 years. Now, in fact, I came here to work for somebody, not to start a clinic or clinic chain or hospital chain or hospitals, pharmacies and all. It was like working for somebody for 2 years, going back. I was teaching there in the medical college. So I wanted to go back and join the medical college service. But he told me after being here for some time that with my qualifications and the requirements in Dubai, I should start something in Dubai of my own. This person is a friend of mine who is a doctor in Ajman. So he wanted me to come to Dubai and start this clinic. I never thought about that at that time because I had always thought that I am going back. But when he told and then started pushing me, that was something which brought me to Dubai. And then after that, we started the clinics and established the pharmacies and hospitals. So what I wanted to say as a philosophy is that you decide on something, but God pushes you in a different direction. I would have gone back and returned to my teaching profession, which I really love. But at that time, he asked me to start this, and that's why I'm here now. So I think that man proposes, God disposes. And when opportunity comes and knocks, you should just open the door instead of complaining of noise pollution.
Dr. Moopen, being the Managing Director and the Chairman of Aster DM Healthcare, could you tell us about the formation, your voyage, when it was the formation of the Aster, please?
This journey started with very few people. We started as a single doctor clinic, and then the clinic expanded, and we had other doctors joining. Then we had a chain of clinics. We had maybe in 10 years' time 4 or 5 clinics. And then the pharmacies as a support for the clinics, that also came at that time. So we had maybe 4 or 5 pharmacies and for similar number of clinics at that point of time. Then by end of around 2000, we thought of the hospitals. So we started a hospital back home in India at Calicut. And after that, we also started a hospital here. By that time, we had started feeling that there's a requirement and there is an opportunity to expand this. So more of clinics started, more of pharmacies started. And then the private equity firms came into the picture by 2007, 2008. Then the funding was there, so it became an exponential growth. So by about 2010-11, we had a very, very fast growth, exponential growth. We went to other countries like Oman, Qatar, Saudi Arabia. Then also India, we had other new units being started. So this whole journey was initially very slow, few people. Then went into a phase where it started momentum. It started gaining momentum with new people being added, and the funding as well as the profits being generated being plowed back. And that has helped us to grow to this size. Now we have about around 200 establishments. Mostly it's pharmacies, so you have large numbers of pharmacies. Then you have about 60 clinics or so in different locations. and around 15 hospitals altogether in India and the GCC countries. So altogether, we also have about 10,000 people with us, about 5,000 in India and 5,000 in the Gulf countries. So that is what happened in the last 27 years.
Doctor, as you mentioned now, with a large number of pharmacies, clinics, hospitals in general, you have mentioned that you have almost 10,000 employees. So how does it feel like to save millions of people's lives? Can you share with us an unforgettable situation that you have faced?
We have a large number of very committed staff with us, starting from doctors on to nursing, technical. And the most important thing is the commitment, which is very important in a profession like healthcare. So they are doing a job, at the same time they are helping people, saving lives, as you rightly mentioned. So the aim of the people in healthcare, I feel that, should be to take care as well as cure, rather than looking at as a job. So I always feel that that's the most important thing. So we take care to get people who are committed, passionate to healthcare. So these people, they touch the lives of millions every year and reduce the pain of several thousands and save the lives of many. That's quite natural in field of healthcare. But it all depends on how committed you are. If you are looking at a 8 to 5 job and wants to go back at 5 o'clock, I don't think healthcare is a job, is an area which you should choose. So there have been a lot of situations where doctors, beyond their time, beyond their duties, they sit back or stay back to serve the patients. Lot of occasions where people who have been brought half dead, who have been into severe problems into our hospitals, have been saved. This is something which has to be seen as a commitment rather than a duty.
Exactly. Yes.
So I can tell you many examples, but due to the want of time, I don't want to go into that. But what I want to say is that anybody who wants to take up healthcare as a profession, as a doctor or as a nurse or as a technician, it's a teamwork. It's not a solo game. It's not like tennis match. It is more like a football match where a combination is required. People have to work together, then only there will be a good result. Starting from a lab technician who looks at the blood of the patient and gives you the result, who is very important. If he gives a wrong result, then the whole diagnosis can be wrong.
That's right.
So everyone in this, the nurse who takes care after the doctor gives the treatment, everyone is important. It's not only a doctor's game. Everybody has to be there. So as a team, they all work very well. They are all very committed. There may be exceptions. So occasionally you may get people who are not to that level, but most of our people, we have found that they are very committed people. And we also give a lot of importance to quality, because our most of our hospitals are accredited by the accreditation bodies, including Joint Commission International of US or the Indian accreditation body called NABH. In fact, our Indian hospital, which I mentioned, the first one which we started, is the first hospital in India to be accredited by the NABH. So that was a great recognition where I got that award directly from the then President of India, Dr. APJ Abdul Kalam. So we put a lot of stress on quality. We put a lot of stress on teamwork and to get passionate and people who are compassionate and passionate to work in healthcare.
Working hand to hand,
Yeah.
of course. Doctor, we want to know what's the secret behind your success in a field where so many others have failed to achieve the same.
Yeah. See, the secret of success, if you look at, I believe that one of the most important thing, which I mentioned earlier, is the grace of Almighty God. So if you are at the right place at the right time, then it's half done. So I've been here at the right time, at the right place. UAE is a country which gives a lot of opportunities for entrepreneurs. So I've been here. Suppose I have been in some other country, I would not have done this well. And it was the right time, there was a requirement. Even now there is a requirement. Suppose I had gone to a country where healthcare is so much developed and it is not required, I would have been in a very different place. Suppose I wanted to start this in America, it would not have been a success. So right time, right place is very important. Now along with that, you should also work hard. It's very important. You shouldn't think that everything is done if you are in the right time, at the right place, and you have the right opportunities. You have to work hard. I worked very hard initially. Now looking back, I or others think that this all happened. But there have been huge amounts of work, hours, 14 hours, 16 hours of tough work, seeing 100, 150 patients alone every day. So that's another part of that hard work. And then most importantly, I think it is the capability for you to build a team. So for me, that has been, I have been very lucky to have a team of doctors as well as other staff, including management staff, who are with us for pretty long haul. Our doctor attrition rate is only 95%. 95% of people who have joined us have stayed back with us. Like that, any area you look at, including nurses, which usually the attrition is very high, we have got very high retention of staff. So that's a very, very important thing. We believe in people. We think that they are the reason for our success. So if you take care of our people, they will take care of the company. So that's our philosophy. So recently we have coined a new term. We started this in when we were launching one of our new centers in India, big center coming up next month. So we had a catchword which said, "We will treat you well." So that's a very simple statement. It's as if you are telling the patient, "We will treat you well."
We'll take care of you.
Yeah, but it was not like that. This was a commitment from the senior management to the people just below that we will take care of you. They are telling the larger people who are under them that we will take care of you. And that resonates to the public that we will take care of you. So like a group song, everybody together tells to the people that we will take care of you. So it's very important that we take care of you. So that's a commitment to everybody in the company. Starting from me, I am saying that I'll take care of you, means that has got a value. Then the people will tell who are coming there that we will take care of you. So it's very important. So if you ask me why we have been successful, it is all this together, God's grace, hard work, teamwork, all together has helped us to reach this stage.
Of course. And doctor, is there any plan to expand the Aster healthcare in general?
Yeah.
Any projects? Can you tell us, please?
Yeah, we have a huge plan. As we go forward, we have one thing, we are going for an IPO shortly, and within the next 1 year we'll be going for an IPO. And we have expansion plans both outside India as well as in India. From the present numbers, in the next 3 years, we hope that we'll be able to reach somewhere around 300 to 350 units. Presently, we have about 200. So the number of staff, the turnover, profits, everything should be going up in the next 3 to 5 years. We also have a vision to 025. That's a 12-year vision which we started last year. So that is divided into 3 4-year periods. Mm-hmm. The first one ends in 2017, then 2021 and 25. So each of this we have plans where we want to go. So we are now a company which is in the Middle East as well as in India, which we want to take beyond that into other geographies and make it into a global company by the year 2025.
There is a long plan ahead.
Yeah. It's very important that you have a roadmap so that you can focus and work. Otherwise, you won't get that focus to work. You won't know what you are doing. You will be working very hard. But if you are not sure where you want to reach, then you are not going to reach the destination. You may go astray and go to some other place. Instead of that, if you have a clear roadmap, it becomes much more easy.
Exactly.
Yeah.
Doctor, we've heard that you have given 20% of your wealth, that's 1 billion, to Dr. Moopen's foundation. So could you share with us and the viewers about the foundation?
Sure. Yeah. I think that God has been very kind to me. He has given me everything, including health, wealth, prosperity, fame, everything. So He has been very kind, and over the last, throughout my life, I have had a very good family. I have got a very good social standing and sufficient wealth to carry forward. So I thought that it's very important for me to pay back to the society, to the people who have helped. And there are a lot of people who require this help, especially in countries, third world countries. There is a lot of requirement for help. And healthcare being my area of expertise, and from where actually we have built this, whatever we have done so far, I thought that we should focus on healthcare when we are giving back. So we have a lot of projects happening in the area of healthcare in many countries. We have in India, a lot of projects happening in different parts of India, as well as in Philippines. We have large number of projects happening. There's a reason for that, because 20% of our staff are from Philippines. So we thought that it's important that we give back to them. We do also other countries, like we are doing in Afghanistan, some charities, and we are also doing in Africa. And of course, locally here, whenever there is a requirement of something, we do. So it goes from starting from just educating people about healthcare related matters, on to supporting in very complicated things like cardiac surgeries. We do a lot of things. In Philippines, we have sponsored about 20 children for cardiac surgeries. In Afghanistan, we are sponsoring children for cardiac surgeries. So we have earmarked. I thought that I have my wife and 3 daughters. So I have 4 people who are natural heirs for me. So I thought that I should have another heir who should be the poor people requiring. So that's why this 20% came actually. So whatever is in my, as wealth with me, I want to share it with the people who are requiring that. And that process is going on. That's running dialysis centers in India, or cardiac surgeries, or disease detection centers. We have 3 or 4. We have mobile medical centers in different parts of India. A lot of activities are happening.
And as a return, you will feel the appreciation from these people as you see they're healthy again. And
that's true, very true.
Yes.
Yeah, you get that feeling of happiness. See, as I told, you can stand tall because you have achieved something. But it's also very important that you bend down and lift people who are in need.
Who's in need, right?
And that is actually maybe the best exercise for the heart. If you bend down and lift people in need, your heart will become stronger.
Thank you, Doctor. Thank you for sharing with us your experience and your knowledge. It's been our pleasure to have you here.
Thank you very much. Thanks a lot.